Do you suffer with lower back issues, tight hips, that sort of thing? Well, this little exercise is to try and release the hips, which can have a massive effect on your lower back and your comfort in general. So what we're going to do is get into a hurdled position. So I've got my right leg forward. My right thigh is perpendicular to the front of the mat. There's a right angle at my knee, and then my right shin is parallel to the front of the mat. There's another right angle in my hip, so my left thigh is parallel to the front, right angle at the knee, and the shin is perpendicular to the front. I'm then going to rotate my torso and try and face squarely to the front. I'm using my hands on the floor to brace myself here. If you're tight in the hips, which I am quite tight in the hips, my hands do quite a lot of work in this position. And you'll see when I go onto the opposite side, I'm far tighter, and the whole system is a little bit less comfortable for me. Anyway, what we're going to do is the distance between your belly button and your sternum stays nice and long. So I don't want to see your body round down like this. I want it to stay nice and long. Use your hands as braces on the floor as needed, and you lean forwards and bring your torso over that front thigh. When you've got as far as you can, use your muscles to push this shin down into the floor to help bring the torso back up. So the body stays nice and long, the gaze comes forwards and down, folding over that leg, and you can't go any further. Push the shin down to come back up. And you're going to do that 5 times. So that's 2, that's 3, that's 4. I'm doing it slightly quicker than normal. I'd take your time over this and enjoy it. You should be getting a bit of a stretch underneath this right thigh hip area. And as you exhale and push that shin down, it makes that tension underneath that thigh a little bit, it heightens it a little bit. When you've done 5 of those, we're going on to the next little bit. I want you to try and lift this shin and this thigh, in this case my right, straight off the floor in one movement, rather than sitting back on the backside, letting the knee come up and then lifting the foot. I want you to keep the weight forwards so you're directly above the line of your pelvis. Again, the hands can help brace you, and you're going to lift the leg straight up off the floor. Up, forwards, touch the floor, and then bring it back and relax. You're going to do that 5 times. So that's 1. Lift, forward, touch, lift, back and down. Up, forward, tap, and back. Up, forward, tap, and back. Last one. Up, forward, tap, and back. So I've done 5 of those. Now we're going to rest this front leg, and we're going to look at this left leg. So again, I want the body to stay still. No rocking like you're riding a horse. Keep the weight directly over the hip bone and the chest nice and long, so your weight is sort of coming through sort of the back side to the top of the thigh area, the sit bone almost on this right side. We're going to inwardly rotate this left thigh, which is going to keep the knee on the floor but lift the left ankle off the floor. I don't have a great deal of internal rotation, and that's what this is to work on. So you will see this leg doesn't actually move a great deal for me, but I am putting 100% effort in. So again, all we're going to do is inwardly rotate the thigh and lift that foot up off the floor. Hold it for a second or 2 and then place it back down. Notice I'm trying to keep my body still, my hands are as brakes to stop me going anywhere. Lift the ankle and place it back down. 5 times again, so that's 2, lift, hold for a second or 2, place it back down. That's 3, up, back down, last one, up and back down. Now I've done those 3 exercises. My final little bit is to try and take my hands off the floor, rotate to the left, so I'm sat on my backside, and rotate all the way around to the back. Now my right hip is much more uncomfortable for me, so I need to guide myself with my right hand into that hurdle position behind. And then I'm going to come back around to the back, through the side, and to the front. Now I've done one side, I'm going to do the other. Now I'm going to do this despite it not being my greatest attribute, because it's to show you that everybody has their own problems that they're working with. Even people on Instagram and YouTube in this case, we all have our issues. I've got really bad hips, despite being a yoga teacher and an ex-dancer. I never would have made a ballerina, but I did dance. So I'm going to go into that same position, hurdled with my left leg forward this time. Again, shin at right, parallel to the front, thigh perpendicular, this thigh parallel, this shin perpendicular. Now you can see, for me to turn my torso and brace the front, there's a lot of weight going down through this left hand to keep me square. It doesn't matter. It's all about working through that fascial tissue in the hips to try and release it, and therefore release a bit of the pressure into the back. The distance between my belly button and my sternum stays nice and long. I lean forward and back 5 times. I tend to inhale on my way down, and as I exhale, I push this shin down into the floor. You can see it's quite different this side. This knee wants to come up off the floor far more, so I am having to work particularly hard on this side. Inhaling forward, exhaling back. 5 of those. So that's my 5. Now I'm going to lift this leg up as I did before. Now I've purposely done this cold. I've not done any warm-ups beforehand, because I want you to see what I actually look like rather than a well warmed up, sort of lubricated me looks like, and therefore doesn't really give you a true adaptation of, or a representation of what this pose is doing for me. When I do this, I often get a little pop inside my hip. So I've done it cold to see if you can hear that pop. So there's a lot of effort going in, as you can see. No pop on that one. No, looks like it's not going to go today. Oh, as I was talking, it just went. Whether or not you heard it, you probably didn't. That's 4, last one. 5. Now this is my nemesis. I have very limited range of internal rotation on this thigh. So for me to get this ankle off, I am honestly putting 100% of effort in, and you will see that foot barely move. But over the course of the 5 repetitions that I do, hopefully you'll start to see that ankle move up, because the fascial tissue in my groin is releasing a little bit. So excuse me while I don't talk from this, because like I say, this is 100% of my effort. That's 2. That's 3. It's just beginning to move. I don't know whether you can see that. 4. 5. Now I can take my hands off. I couldn't do that a second ago. I'm going to roll to the back. I'm going to roll all the way around. And then I come back and back into that hurdle position. And you can see, although it's not pretty, I can sit there with my hands off, which I couldn't do before I did this. The other thing is, I'm going to now sit cross-legged again, which I started with. And you can see, that is far more comfortable for me. So that has released my hips, and in turn, my whole lower back is having to do less work. It's in a more comfortable position, and I'll be, if I was in pain, I'll be in reduced pain. But that is an exercise that I do quite regularly for my own problems, so hopefully that might help you. Thanks very much. If you like this, please like, subscribe to my channel, and leave me a comment, see how you get on with it. And I'll see you in the next one. Thanks.